brief set of announcements about COVID-19 in Commissioner's Court today. If anyone tries to tell you that there's nothing you can do to persuade them to get the COVID-19 vaccine, tell them they're wrong. And we have the facts to prove that. Over the past week, we've seen an overwhelming response to our vaccine incentive program. It's a win for the people of Harris County, and it's a much needed boost to the healthcare workers that have been working day after day, seeing tragedy, unnecessary tragedy in their hospitals, and so many families that continue to struggle with this virus. Here's some details and some context. For the 3 weeks prior to the start of our cash incentive program, our public health department administered an average of 431 first doses per day. The same day we announced the program, the number of first doses almost doubled to 914. The next day, Wednesday, 1,596 people sought a first dose. And it's just gone up from there. On Saturday alone, over 2,700 people, a 529% increase, sought a first dose from Harris County Public Health. This is an incredible achievement, and I want to thank commissioners who supported this initiative, Commissioner Adrian Garcia and Commissioner Rodney Ellis. To deal with this surge, we're taking action. Starting today, we're opening an additional mass vaccination site at Sheldon ISD Panther Stadium. That site will have the capacity to provide 1,500 vaccines per day. It's located at 11411 C.E. King Parkway in Sheldon. Hours will be the same as current hours, 9 to 7, Tuesday through Sunday. Starting on Thursday, we will also move the NRG Park vaccination site to Dick Graves Park on Reed Road. It's a location where we have the capacity to provide 1,800 first doses and 2,500 total vaccines a day, an increase from what we can provide at NRG Park. We're also increasing our mobile unit capability. So by this Friday, Harris County Public Health will be able to offer a total 4,600 first doses and 7,600 total doses, including Dick Graves Park, Sheldon ISD Panther Stadium, and our mobile sites. The Dick Graves location is at 2,000 Reed Road, and it begins operation on Thursday, August 26th. It's on 288 South, past the 610 loop, is not far from NRG Park, and we'll have plenty of signage to make sure and direct people there. Hours are also going to be the same, 9 a.m. to 7 p.m., Tuesday through Sunday. There will be no pause in operations between the closure of NRG Park on Wednesday and the opening of Dick Graves Park on Thursday. The way you get the vaccine, along with the $100 cash incentive, remains the same. Show up, register online, get your vaccine, receive $100 cash card for the vaccine. You visit readyharris.org or call 832-927-8787 to register, to pre-register, and to find the sites that are available. We have around 10 any given day. Today I'm also requesting $30 million to procure hundreds of additional nurses for our region. I'm grateful to the support from the state in providing nurses to our region. Some have arrived already, and it's incredibly helpful, but there's still a gap, and it's urgent. Over the past several weeks, we've been in touch with officials from the Southeast Texas Regional Advisory Council. It's the group CETRAC for short, that is responsible for coordinating the needs and the resources of our health providers, our health agencies during emergencies in particular. We've been in touch with them to determine what the needs are, between what the state has provided us and what's still necessary for our hospitals. We've assessed the maximum amount we think we may need based on the maximum length of time these nurses may stay, and that's how we've arrived. The experts have arrived at this $30 million figure. To be clear, we do not anticipate that this entire amount will be needed, and we will work to keep the total expenditures as low as possible. And again, this is an estimate that we received from the Southeast Texas Regional Advisory Council based on their survey of area hospitals. Harris County Public Health and CETRAC will also work to ensure that these nurses come from outside our region. So we're not just taking nurses from one hospital and putting them in another hospital. Depending on how quickly we can get this contract out, I'm going to put it before the members of court as the first item of business in Commissioner's Court today. These nurses could be here within 72 hours, and so we need to hurry up and get that out the door. The request will support hospitals around the county, not just our public hospitals. And let me close with a brief update on the Small Business Recovery Fund, a relief fund that we announced here just a couple weeks ago. Since we announced, we've had a lot of questions from small business owners about how the program works, and that's a $30 million program to support the smallest of small businesses throughout our community. The application period opens September 20th, but today the website is available. And so folks can begin reviewing the requirements, checking out any frequently asked questions, and reaching out if they have questions about how to apply. The website is harriscountybusinessrelief.org. And so I encourage small business owners who've been impacted by the pandemic to check out that website. So I'll leave it there and answer any questions you may have. Actually, I need to repeat my remarks in Spanish, so let's start there. Brevemente en español. Si alguien le dice que no hay nada que usted pueda hacer para convencerlo de que se vacune, dígale que está equivocado. Hemos visto la prueba de esto. Durante la última semana hemos visto una respuesta abrumadora a nuestra iniciativa de $100 por cada primera dosis de la vacuna contra el COVID-19. Este es un triunfo para los residentes del condado Harris, también es un triunfo para los trabajadores médicos, los trabajadores de emergencia que están lidiando con esta crisis ya por la tercera o cuarta vez, que siguen viendo tragedia sin necesidad en los hospitales, tantas muertes por este virus. Unos detalles. Durante las 3 semanas antes de nuestro programa de $100, en promedio nuestro Departamento de Salud Pública administraba 431 primeras dosis al día. El día que anunciamos el programa, simplemente en ese mediodía administramos 914. Ese miércoles 1,596 personas visitaron nuestro departamento para recibir una primera dosis. Y el sábado, más de 2,700 individuos recibieron una primera dosis contra el COVID-19, un aumento de 529% comparado con lo que habíamos visto antes del inicio del programa. Entonces es una victoria increíble. Le quiero agradecer a los miembros de la Corte que apoyaron esta iniciativa, al comisionado Ellis y al comisionado García, y espero que sigan tomando ventaja. Para manejar este aumento, hacerle frente a este incremento en la participación, estamos tomando medidas. Empezando el día de hoy, estamos abriendo un sitio adicional de vacunación masiva en Sheldon ISD, en el Panther Stadium. Va a tener la capacidad de ofrecer 1,500 vacunas al día. Ese estadio está en el 11411 City King Parkway en Sheldon, en el área noreste del condado. Las horas de operación igual de lo normal, de 9 a 7, martes a domingo. Este jueves vamos a movernos de la sede de Energy Park a un sitio nuevo, al Dick Graves Park, en la calle Reed Road. Esta sede va a tener la capacidad de ofrecer 1,800 primeras dosis y 2,500 vacunas al día en total. Es un incremento de lo que podemos ofrecer hoy día en NRG. También estamos incrementando nuestra capacidad de las unidades móviles. Entonces, este viernes vamos a poder ofrecer en total 4,600 primeras dosis y 7,600 dosis en total, incluyendo Dick Graves, incluyendo el estadio en Sheldon ISD, incluyendo las unidades móviles. La sede de Dick Graves Park, la dirección es 2000 Reed Road, queda cerca del Energy Park, está en la 288 pasando la 610 y estará abierta también de 9 de la mañana a 7 de la noche, de martes a domingo. El proceso de cómo recibir la vacuna, recibir sus $100, sigue siendo el mismo. Visite readyharris.org o marque al 832-927-8787 para recibir las horas de operación, para ver, tenemos 10 sedes cada día para ver dónde están y también si necesita el transporte, lo más importante, para sacar una cita. Pues puede llegar, si no tiene cita puede ir directamente, pero le pedimos que intente hacer una cita, así no va a tener que esperar tanto tiempo. En cuanto llegue, recibe la vacuna y después recibe sus $100, no se hace ninguna pregunta, no se le pide ni siquiera identificación y mucho menos prueba de residencia ni prueba de ciudadanía. Hoy también estoy pidiendo a la Corte $30 millones para contratar cientos de enfermeras adicionales. Agradezco el apoyo del Estado, que nos ha ofrecido enfermeras ya en las últimas semanas, pero aún hay una necesidad urgente. Durante las últimas semanas hemos estado en contacto con hospitales y con líderes en el Consejo Asesor Regional del Sureste de Texas, CETRAC. Es la entidad que se encarga de coordinar las necesidades, los recursos del sistema médico, especialmente durante las emergencias. Hemos estado en contacto con CETRAC para determinar las necesidades que hay en cuanto a la cantidad de enfermeras en la región. Hemos analizado el tiempo máximo, o ellos pues nos han dado una proyección del tiempo máximo que vamos a necesitar las enfermeras, la cantidad máxima de enfermeras, y nos han recomendado esta figura de $30 millones. Para que quede claro, no anticipamos que vayamos a necesitar todos los 30 millones, pero queremos tener suficientes fondos para contratar todas las enfermeras que se necesiten. El Departamento de Salud Pública trabajará con CETRAC para asegurarse que las enfermeras vengan del área fuera de la región, que no estemos contratando simplemente tomando enfermeras de un área en el condado para ponerlas en otra área, o de un área en la región para traerlas a nuestro condado. Dependiendo de qué tan rápido se pruebe este contrato, y lo voy a proponer aquí al principio de la agenda en corte, las enfermeras podrían estar aquí dentro de 72 horas, y sabemos que las necesitamos. Hay muchos hospitales que no pueden operar, no por falta de camas, sino por falta de trabajadores médicos. Esto va a apoyar hospitales a través del condado, incluyendo hospitales públicos y privados, no solamente el sistema de hospitales de Harris Health. Finalmente, una breve actualización acerca del fondo de apoyo a las pequeñas empresas. Establecimos el fondo hace un par de semanas, son $30 millones para las pequeñas empresas en nuestro condado que han sido impactadas por el COVID-19. Se priorizan las empresas con dueños que son minorías, en áreas de bajos recursos, empresas más pequeñas. Entonces, invito a todos que se informen. El periodo de aplicación empieza el 20 de septiembre, pero el día de hoy ya está en línea la página web con toda la información. Entonces, la página web es harriscountybusinessrelief.org. Los invito a que visiten la página si usted es un dueño de una pequeña empresa, y así se puede informar antes de que abra el periodo de aplicación el 20 de septiembre. Muchas gracias. Thank you.
Just talk a little bit about, after months of closing vaccine sites, what's it feel like to actually open one back up?
Oh, I'm relieved, I'm grateful, and I'm proud of this community. I'm so proud of this community. We're in a tough time. We continue to see record numbers of hospitalizations across our region. But we also have a light to get us out of this, and that is the increased participation in vaccination sites. So I hope this continues. I hope people continue to take advantage of this, because to the extent that folks get the vaccine, that's our ticket out of this crisis for good.
Did you think it would lead to you opening up another site?
We were hoping we'd have a positive response from the $100 incentive, but we weren't sure what we were going to see. And we had an inkling that something was going right when I started my announcement at noon, and by the time I was done 30 minutes later, there was a line of cars waiting to receive the vaccine. We hadn't seen those lines in months. And so it's great. If that's what it takes, wonderful. That's how you make good policy. You have to be creative. We're seeing the results, and so we're doubling down on it. And so you could show up, get your $100, and we're going to continue working on making this initiative a success.
And describe the situation right now in the hospitals with the nursing shortage.
There's the challenge, of course, of limited beds, and that happens in certain areas. But in many hospitals, the challenge is not so much a lack of beds, it is a lack of medical personnel to staff them. In our public hospitals, for example, we're having to turn people away, we're having to keep people waiting for hours. The CEO of our public health system, or our public hospital system, for example, was explaining the other week, a man with pancreatitis had to wait 40 hours for a bed at our public hospital. But we have beds that are sitting empty because we simply don't have nurses. So we've requested nurses from the federal government, we've requested nurses from the state, we received some nurses from the state, incredibly helpful, not enough to meet the complete need. And so at this point, we have to step in. To the extent that people get vaccinated, this surge is going to end faster. We're going to need the nurses for less time. We're going to strain our hospitals a lot less. But right now, that strain in the number of nurses, that strain in the number of beds because of the unvaccinated population means that ambulances are having to wait, that people with urgent needs are having to wait, that paramedics, firefighters, all of them are delayed, impacting well beyond those with COVID. We are now impacted folks who have any kind of emerging condition, a stroke, a heart attack. I mean, it goes beyond the pale. It is the time right now to get vaccinated.
And so my question about the $30 million is, first of all, is that approved or that still needs to be approved?
That needs to be approved by Commissioner's Court. It will be the first item I bring up on the agenda here in 30 minutes.
And you're confident it will?
I hope so. I don't know until I hear from my colleagues at Commissioner's Court, but I sure hope that they will approve this $30 million. It's urgent. It's not. It's a request that has come from this regional advisory board that communicates with all hospitals and has said, hey, we need these funds. And so I think anybody would be hard pressed to turn that down.
And then I guess how does that work? Like, what does that $30 million actually go towards? Like, what does it fund?
The $30 million funds nurses for our region. It doesn't mean we're going to spend the entire $30 million. $30 million is an estimate of the maximum amount of time, the maximum number of nurses, and the most expensive nurses. You have to remember there's different kinds of nurses. And so CETRAC is surveying the hospitals to understand exactly which kind of nurse they need, and that'll determine how much of that $30 million we're going to have to spend. As we see what happens with this latest surge of the pandemic, we may need to keep the nurses for many weeks. We need to keep the nurses for a few weeks. And so the maximum is $30 million. I am confident, I surely hope that we will not hit that maximum, that we'll be able to keep it lower, much lower than the 30 million, we'll see. And it'll be for hiring nurses from outside our region to come and fill in throughout the hospitals in our region, public and private.
Okay, so all hospitals, do you have a list or just all of them?
This group, CETRAC, is coordinating with them, and so any hospital that needs nurses are in touch with this coordinating agency. But yes, hospitals qualify, and so that's why we're doing it through CETRAC, is so that they can really assess, okay, who needs what, and how do we distribute in the most efficient way.
Okay, and then this is a question from Telemundo. If they're asking you to answer in Spanish, anything you're planning to do to deal with the rise in hospitalizations in our area due to COVID? And then the other one is, are you going to open the NRG hospital and when? If you could do both those in English and Spanish, actually, that'd be great.
Yeah, so the first question is how we're going to deal with the surge in our hospitals. And there's two prongs to that. The real long-term solution is for people to get vaccinated. And that's why we're doing everything we can to get vaccines out the door, not just with the incentive that is working, but also with expanding capacity so we can respond to that surge in vaccinations, which is fantastic. We need to keep that going. Another piece is making sure that we have the personnel while this crisis is ongoing. And so that's why we are requesting funding for additional nurses to come to our region over and beyond what the state has sent. As far as the second question?
The second question was, are you going to open the NRG hospital and when?
As far as opening the NRG hospital, that is a conversation we're also having with our public hospitals, our private hospitals, and the regional coordinating agency, CETRAC. And so far, what they've told us is what they need is more nurses, not so much more beds. And so that's why they don't currently need the NRG hospital. We do have two options on standby, one option at NRG, one option at another location, if the hospitals were to tell us you need to open this. But right now, the main request, we've been in very close communication with the leaders of all our hospitals, and the urgent request is vaccinations and nurses. And so that's what we're doing. In Spanish.
You want me to repeat them?
I think I got it. Primero era, ¿qué vamos a hacer acerca de este incremento en las hospitalizaciones? Las hospitalizaciones, el incremento en hospitalizaciones tiene dos partes. Una parte es el número, obviamente, de personas que se están enfermando. Y la solución a largo plazo para eso es la vacunación. Es por eso que tenemos este programa de incentivo de $100. Estamos haciendo todo lo posible para que la gente se vacune y además expandiendo la capacidad de nuestras sedes de vacunación para absorber ese incremento en la participación, la cual es genial. El segundo punto es la necesidad del personal médico, de los trabajadores médicos, que puedan lidiar con este incremento en hospitalizaciones que está sucediendo ya mismo, en este momento. Y es por eso que estoy pidiendo $30 millones, hasta $30 millones para traer más enfermeros a nuestra región para que puedan ayudar a tratar esos pacientes. La segunda pregunta era acerca del hospital en NRG, del refugio médico que hubo en algún momento, que si lo vamos a volver a abrir. Hemos estado en comunicación con todos los líderes hospitalarios en nuestra región, con CETRAC, la agencia que ayuda a coordinar a través de los hospitales, y lo que nos dicen estos líderes es que en este momento no necesitan que abramos el refugio médico en NRG. Tenemos dos opciones, tenemos una opción en NRG, una opción en otra sede, listos para activarse en 1 o 2 días cuando sea necesario. Pero hoy día la necesidad principal son las enfermeras, no tanto más camas de hospital. Entonces, por eso estamos enfocándonos en más enfermeras.
And I have another question from, while I pull that up, the 30 million, that goes into effect as soon as it's approved?
As soon as it's approved, the reason I need to do this as soon as we start the meeting of Commissioners Court is because the sooner it's approved, the sooner the team can draft up the contract, negotiate with the staffing agencies, and get those nurses over here.
Okay, this is from Telemundo. They're asking you to answer in Spanish. There are multiple families saying they have had issues with the apartment complex when they receive the rent relief payment. Apparently they don't get enough to cover for the month payment. Can you please, 2 questions, can you please explain what the families can do so they don't get evicted? Also, is there anyone in the county verifying that these families are covered after they receive the payment for their monthly rent?
Es una pregunta acerca de nuestro programa de asistencia de renta. Es un programa enorme de docenas de millones de dólares. Ha funcionado relativamente bien, pero obviamente como cualquier programa van a haber retos, especialmente si estamos hablando de docenas de miles de individuos, de familias, así como dueños de apartamentos de edificios. Entonces no sé exactamente acerca de esos casos, pero vamos a referir esa pregunta al departamento dentro del condado que maneja aquel programa, a ver qué se puede hacer. And what I mentioned was, it's a question about the rental relief program. It's a program that's worked incredibly well, tens of millions of dollars. It's serving tens of thousands of families and landlords during these tough times in COVID. It's been highlighted by the federal government. And like any large program, it's gonna have some issues. I had not heard about this particular issue, so we'll have the relevant department reach out and see if anything can be done.
Perfect, thank you. I don't think I have any more. Do you have any more questions? We're good?
All right, thank you guys so much.